A very warm welcome, everyone. I, Dr. Nishant Sharma, on behalf of Voice of Healthcare, thank you all for joining us today. Welcome again on our episode 2, the series of our broadcast, Emerging Trends in Medical Tourism. To give our viewers some context, in this series, we aim to pick brains of some of the finest industry leaders in the medical value tourism segment. We discuss the need, the scope of MVT, and in today's episode, I'd like to welcome Mr. Kapil Munjal, the CEO of Treatment Traveler. Good evening, Mr. Kapil. A few words of self-introduction, please.
Hi, Dr. Nishant. Thank you for having me here.
Obviously, sir.
We are Treatment Traveler trying to do some work on medical value travel across the countries on digital platforms. We've been pretty successful in various verticals and various our objectives. We're now set to kind of take it to the next level.
All right, sir. So to bring everyone to the context of this conversation, today we'll be specifically talking about the changing trends and the changing landscape of MBT in the last 20 years. You can call it a compare and a contrast. We'll talk about how different medical specialties and what particularly is the most consumed medical specialty that we are seeing. And we'll also talk about India, its particular position in the global medical tourism industry segment. And we'll also speak a little bit about how COVID has changed the entire game and what are the new different industry leaders doing to consume the sun. So I hope, Mr. Kapil, you are ready with the questions. I will shoot them our way.
Sure, look forward.
Yes, sir. So to start with, I think the first question, which obviously will set the context of this conversation, what exactly is medical value travel? So I'd like to hear your thoughts.
Medical value travel has been there for ages now, for centuries. Whenever people don't get quality healthcare in their own home country or in their hometown, they travel outside of the place of stay to get medical treatment. It could be curative, it could be preventive wellness. People travel for all sorts of medical reasons. Healthcare has been on forefront on the foreminds of everybody across all population, across genders, across the globe.
Right. So if we talk about, like you said, that medical value travel has been there for last multiple number of years. How would you compare and contrast the today's India's medical value picture when comparing it to, let's say, 20 years ago? How do you feel has it changed? How well has it emerged out?
India as a country offers unparalleled advantages. World over, if you see in developed and in underdeveloped countries, you have problems of healthcare access and costs. And in India, we have none of these problems. We are very fortunate in India to have, developed a large pool of highly talented healthcare professionals, including doctors and their supports, labs and everything. Hospital infrastructure, everything is in place. Access is not a problem at all when you compare to the developed world or even underdeveloped world. And costs are a fraction of what you see anywhere else in the world. So, to give it a heads up, we are at about 10% of the cost as a thumb rule. Not really, it won't apply to everything, but we are at a 10% of the cost that is being offered in the US. Say about 20% of the cost of Germany, about one third of Singapore, and maybe half of our peers like Thailand or Turkey, etc. So, in short, what you're getting is maybe the highest quality healthcare at a fraction of the cost. To compare it, you're getting a new iPhone in US for $1,500, and you get the same iPhone, same model, at the same time for $150 in India.
Right.
That's the strategy.
Right. So talking about, I would say, like you just said about elective surgeries or very serious complications that people travel for. What are the most, I would say, consumed specialities that we see people traveling to India for? In a very specific thumb rule, if we try to speak about it, what do you feel has been the trend in the specialities?
So in the past, there have been limited number of specialties which have been promoted by India overseas. Traditionally, it started with cardiology, but now in the recent 2, 3, 5 years, it's been oncology, organ transplants,
Hmm.
neurosurgeries, advanced trauma, and orthopedics. Of course, cardiology remains there, pediatric cardiology included. IVF has emerged very strongly in the last couple of years, 3 years. But now, given the exposure to markets like Turkey, etc., who promote non-traditional uh, specialties like cosmetology and hair transplant, etc., that is picking up as well in India. A
Okay.
lot of people from the developed world do travel to India for wellness, notably Ayurveda,
Okay.
especially in areas like Kerala and Goa. You see a
Hmm.
lot of travel from Europe, Japan, US, etc., for Ayurveda.
I see. So I think it's not just about the traditional medical practices, but also the Indian particular subcontinental traditional practices are also getting famous through this route of medical value, is what I think you're trying
Yeah,
to.
just that Ayurveda has been very quiet about it, and they do it very humbly, and the number of patients are huge.
Right, right. So, switching over to the first question again, like a subsidiary question to that, how well do you feel has India climbed the ladder? I mean, I see that a lot of these Western countries like the Europe or let's say even the US, they show a very higher quality of care. How well has India climbed that ladder and trying to place itself amongst the top global medical value destinations throughout? I mean, what are your thoughts on that?
See, it's a big question because healthcare aspects are many. Quality being one, cost being another, accessibility being another. Ability to help their local doctors, upgrade their skill levels being yet another one. Convincing the Western countries that look, you need Indian healthcare at least, the doctors and nurses. NHS
Mhm.
is a big, big question, but I'll try
Right.
to answer it within the scope of time. See, in terms of quality, India is at the topmost ladder, and it is also rightly perceived to be. But when
Mhm.
it comes to costs, though we are delivering at a fraction of the cost, as we just discussed, when you deliver quality at lower cost, sometimes, the very high-end customers, well-paying customers like a Saudi Arabia or maybe
Mhm.
Europe, they would say, "Oh, how can you deliver such high quality at low cost? It's not possible." So there is a challenge of perception from, say, countries who have not come to India in large numbers, but
Mhm.
from countries which have been coming to India in large numbers, patient word of mouth has spread really well, and us doing in terms of quality, access, costs, everything, I think is not a mixed bag. India has done really well, but given all these deliveries, positive deliveries that India as a country has done, the achievement in terms of patient numbers is a
Mhm.
fraction of what we should have achieved. So it's a mixed bag. So in terms of
Okay.
delivery, it's very high, but in
Mhm.
terms of rewards that India should have got as a country
Right.
is a mixed bag. But now with Prime Minister Modi and the governments of health and everybody, really focusing on medical value travel, in G20 we've seen on the sidelines, MVT has been an agenda.
Mhm.
So it's just a matter of time that we'll get our due.
Right, sir. I hope the same. I mean, obviously, with everything changing, with India climbing its ladder, I'm sure quality was never really a question for India's healthcare anyway. It's about the visibility. It's about the testimonials. I think what the past patients and the word of mouth that is going to spread very soon. So very rightly said. Moving on to you, how do you feel is treatment traveler changing the game? Tell me a little about yourself. Tell me about your organization, your values, your team. What are you guys doing? I'd like to understand more. Our audience would like to understand better. Yeah.
So treatment traveler is a set of professionals. We most of the people are from healthcare background. They're the ones who speak to the patients.
Mm-hmm.
Uh, I'm from a media background, so reaching out to people, raising patient awareness is what I do primarily. And
Mm-hmm.
then once the patient is on board on our digital platforms, it is a set of doctors and MHAs, the Masters in Healthcare people who kind of take over and take the conversation with the patients.
Mm-hmm.
Now, we at Treatment Traveler are trying to address the issues of healthcare access and costs in all underdeveloped and developed countries both. At the
Mm-hmm.
same time, trying to bring India to the position where it deserves to be in the medical value travel space. We use patient trust and only patient trust as our currency. A lot of
Right.
our patients, large percentage now, are referred to us by our ex-patients.
Mm-hmm.
That's largely because of the high value of service delivery that you deliver across our partner hospitals and doctors. It's a complex thing. I mean, it's easier said than done
Right.
because
Obviously.
there are over 7,000 complex conditions in the ICD-11 of WHO. Understanding each one of those 7,000 and who would be the appropriate specialist to treat that condition, maybe not one, maybe many. So
Right.
understanding that and costs and everything, I mean, it requires a lot of in-depth knowledge, and that's
Mm-hmm.
what value that you bring on the table to the patient is connecting him to the right set of specialists
Mm-hmm.
and delivering the right services within the finite small time of a week, 2 weeks, 3 weeks that he has with him to get
Right.
well up and running and adding to
Mm-hmm.
the quality of his life.
Right, sir. So I also come with an experience from medical value travel. So I completely agree with what you say. I think it's about the quality and the trust that one company can basically provide to their customers is what really gets that chain reaction going on and getting more and more assistance towards people. So I wish you all the best for the same. Moving on to the next question. I mean, this is particularly a very impacted, personally impactful question as well. How do you feel has COVID changed the game or that medical value has been playing? Very specifically, just for India, talking about our subcontinent. I mean, let's talk about the times pre-COVID and talking about right after COVID and today. I would want you to give our audience an answer in a three-part way to try and understand how did COVID change things.
See, the biggest impact COVID has had on people is it's brought healthcare on the forefront of the thinking process of people. So people are now spending more on prevention and wellness,
Mm-hmm.
and we're seeing that in reality as well. So for international patients in medical value, a lot of our percentage has increased for people who come for prevention and wellness.
Okay.
That's part one. Part two is, uh, people would essentially wait for some time to go for a require interventional surgery or intense treatment.
Mm-hmm.
Now, that waiting time has reduced. People would tend to generally say, "Oh, let me wait and see if it would be fine." But
Mm-hmm.
that attitude of a lot of majority of people have changed across all countries.
Okay.
Yeah, so the
Okay. So
healthcare people are taking it seriously, much more seriously now than they were doing pre-COVID.
right. So I think apart from the obvious gruesome side effects that COVID had on our lives, it has made us as individuals a little more precarious about our health. Like rightly you said, it has turned from elective to preventive now. We are shifting towards wellness better. So I think that is true. So moving on to our next part of the conversation, it will be more about technology. So we've been hearing about telemedicine every day, and rightly said, after COVID, we have seen that telemedicine has taken a lot of uprise. It used to be there, obviously, in the pre-COVID eras as well. We used to take doctor consultations over the phones, but it has changed, and I'd like you to give a little bit of your reflection on how has telemedicine improved and what is the future of it in MVT.
Dr. Nishant, you very rightly said telemedicine had been there. We had video calls and audio calls going for many years,
Mhm.
and the adoption in doctors has improved.
Okay.
Earlier, a large percentage of doctors would say, "Oh, what is this? I'm not very
Mhm. Mhm.
comfortable. I want to see a
Mhm.
patient face to face." But
Correct.
now, a vast majority of you see a lot of technologies coming up, and they simply fail because the doctors, the specialists, they don't have time, or due to various other reasons, the adoption by the doctor,
Mhm.
tends to fail that technology. But
Mhm.
telemedicine is one which has been successful because
Mhm.
simply because the doctors have adopted it so very well,
Right.
and the patient benefits are needless to mention. The world knows it. uh, I mean, telemedicine is changing the game very rapidly. It's adding convenience, it's adding, needless to say all those things, it has all the benefits.
Right. So, moving on the same topic, what other technological advancements do you feel are the future of healthcare delivery globally? Not just India, not just for medical value. Any particular interest in technology that has spiced up your brain and you feel intrigued about it? I mean,
Well, Dr. Nishant, see, technology is all about, you teach your children sharing is caring. And
hmm.
technology is doing just that. It's sharing. So every technology that you see, either wearables or diagnostics or even telemedicines, everything is now API first model, which means it is plug and play. So you have
Hmm.
a device which is, say, into cardiology, and I have a technical technology portal where the patients are coming in. So for that technology manufacturer now, is simply plug and play. Yeah, so
Right.
it becomes integrated. So you have persons, a startup sitting in somewhere in a Bangalore, in a London, wherever across the world. You can simply plug into each other and deliver
Hmm.
your services better for the patients.
Right. So I
So
think the digitalization.
it's the interoperability of technologies coming onto the single platform,
Hmm.
which makes it so more exciting. Say your Apple Watch, I think you're
Hmm.
wearing one,
Yes.
and or a Samsung, whatever, right? So you have multiple apps on health, which may or may not be made by Apple.
Correct.
In a similar manner,
Hmm.
on our technology platform, you can plug and play technologies built by other for the benefits of the patients. That's where the future is.
Yes. I think making accessible healthcare more simplified, connecting the dots so that even the most remote areas of this world are connected with the most renowned healthcare facilities is, I think, what the digitalization of healthcare is all about. So, yeah, obviously, I completely agree with you. And what you have said is very right that digitalization and this interoperability between different technological healthcare players is what really is making changing the game for majority of the healthcare associations. So obviously it's lovely picking your brain, Mr. Kapil. With this, I'd like to end the question answer session, and I'd like to thank you for sparing your precious time, speaking with us, engaging with us on this very hot and fresh topic. The Indian government is also a lot pushing on it, so I just thought, why not me? I mean, I should also speak to industry minds, just get a fresh opinion on what things are. So I thank you for obviously sparing your time joining us.
It's been my pleasure, Dr. Nishant, speaking to you and the
Lovely.
Voice of Healthcare audience, and look forward. All the
Yes,
best
sir.
to you. Thank you.
So with this, I'd like to thank all our engaging audience and thank you all for engaging with Voice of Healthcare. Stay tuned for more question and answers round on medical tourism as I continue to find more and more industry leaders to speak and pick their brains on the same. See you all in the next sessions. Thank you, sir.
Thank you.
Thank you.